Welcome back to Thanks for joining me. In the last episode on the population health cycle, we discussed the survey step and the many details that need to be identified through your data gathering to be used in your program. In this episode, we're going to discuss step 3 of the population health cycle, segment. So, what do we mean by segment? One of the keys to an effective population health or chronic care management program is to correctly identify the individuals based upon their risk status. People have unique needs and risks. The segment step is the grouping together of individuals with similar characteristics. These could be similar conditions like heart disease, diabetes, or depression, similar risk factors like age, lifestyle, and the social determinants of health, or similar needs like those associated with maternity, children, or perhaps people requiring a caregiver. Putting this information together allows one to determine who in my population is likely to have poor outcomes or incur higher costs without the intervention. Identify what that intervention or interventions might be needed, and seek to improve the person's condition or maintain their current health status and prevent worsening of the condition, with the goal being improved outcomes, reduced costs, and a maintained or better quality of life. In the early days, one might have placed an individual into a high risk category if they had one or more hospitalizations or two or more ER visits in the prior year. Obviously, this is a very simple methodology and is not very accurate. In many cases, depending on the condition or what occurred to trigger this, the likelihood of it occurring for that individual in the next year is lower. So, automatically putting an individual like that into a high risk category may not be correct. A key to understand is regression to the mean. Regression to the mean is a statistical phenomenon where extreme values tend to naturally move closer to the average over time. This happens due to chance and randomness, not actual change. Without understanding this, one can develop programs that are fundamentally flawed and, in particular, report flawed outcomes. We'll discuss this again in the score stage. Over time, most programs have typically selected three categories for segmentation: low, moderate, or high risk. One takes the information gathered through the survey process and the relevant measures to create a risk assessment. This is one of those devil is in the details areas. There are now many companies that produce accurate risk models which can be applied to your program. Many of these models are built upon hundreds of millions of records of individuals and their medical claims and other information, taking that data and looking at it year over year to identify the changes that occur. They then match the information on your population to similar individuals in their data set. The use of various AI and machine learning tools is coming to the fore in this area and has the potential to create even more precise segmentation. Another very important area to consider and understand is bias. We have seen examples of bias in various risk identification tools because the input data gathered during the survey step was itself biased. Depending upon the instances, they may have left out groups of people or misunderstood the variation in treatment between groups. One must ensure that one has a representative and relevant data set for an appropriate segmentation. This issue of bias is a problem we see throughout healthcare. Transparency regarding how your model works is also critical, as is confidentiality of the personal health data. In the area of prevention and health improvement, D. Eddington's natural flow model, based upon the Michigan HRA, is an excellent example of a segmentation tool. It has clear indicators for bucketing individuals into the low, moderate, or high risk categories, how each category relates to costs, and the changes expected to be seen in a population status over time without any interventions. We'll discuss natural flow more in later episodes as well. Now, imagine a world where instead of three buckets, low, moderate, and high risk, we can achieve a segmentation N of 1, segmenting down to the individual to know exactly what the risks are and what to do to improve their health, regardless of the condition and circumstances. What exact medications to prescribe, what to do to ensure adherence, how to educate the person depending upon their health literacy, how to contact them. Is it text, email, phone call, letter? When to contact them to get the best response, and what to say to impact their readiness to change. All of those and more. all the key levers to improve that person's health status and life. That's the goal of the segment step, and that's why all of the data elements discussed in the survey step and other data are and will become more relevant as the science in each of these areas advances. Thanks for watching, and look for the next episode of the Population Health Cycle Cell. If you'd like more information about the segment step, assistance with your program, or developing a program, please contact us at info@accountablehealthllc.com.